Okay, well, thank you. And I really thank everybody for taking the time tonight to join us. And it's been really a very long 18 months with everything that we're all dealing with COVID. And I thought perhaps it would be time for another webinar just to let you know what's going on in the world of dermatology. And there's an awful lot going on. The innovation is unbelievable. But I also really wanted to get back to some basics. I think sometimes we forget that there are very, very simple procedures we can do to take care of things that are problematic on your skin. Next slide, please. So really, there's an awful lot we can do in the office, but there are things that we can all do for ourselves. It all just gets back to healthy lifestyle, and a healthy lifestyle means, good care for your skin as well. So next slide, please. It's all about exercise, and it's all about taking care of ourselves. Sleep is important as well. We don't think about it very often, but there's a lot going on in our bodies when we sleep. There's an awful lot of repair work going on, an awful lot of healing going on. So don't underestimate how important our lifestyle is and putting together all of these important factors: healthy lifestyle, good diet, sleep, and exercise. Excuse me, next slide, please. There is absolutely no doubt the past 15 years, we've all really been inundated with social media. Facebook, Instagram, TikTok, it goes on and on and on. Myself included. We look at ourselves every day in social media. We see people posting in social media. Wow, they look great. Wow, they don't look so great. We're on Zoom meetings, virtual meetings. Wow, I don't like the way my cheeks look. I don't like the way my eyes look. We become very, very obsessed with our appearance, and we just can't help it based upon all the media going around us. Next slide, please. Right now, we don't have a fountain of youth. We have amazing technology, but we don't have the fountain of youth. I don't doubt we will in the future, but right now we have great technology. The idea is, let's make you look good for your age. Feeling healthy will make you look healthy. And we're going to just try and help you just feel good about yourself. Next slide. So many things go into looking good for your age. Yes, there's an awful lot we do, but it's also how you dress, how you act, how you do your hair, the procedures we do. It's also about the cosmetics you use on your skin. Again, there's a tremendous amount of products out there. It's $1 billion industry. Next slide, please. We can treat everybody. Doesn't matter. Age, sex, skin color. We can do something for everybody. And if a treatment isn't right for you, we're going to let you know. We're going to do what's right for you. Next slide. So cosmeceuticals, huge $1 billion industry, as I was just saying. And these are the definitions for cosmeceuticals. They claim to have medicinal properties. Many claim to have anti-aging properties. And some have some really good science behind them, but others do not. And you don't necessarily get what you pay for. So it's really important to look at a product with an objective eye and perhaps, ask me, ask Dr. Laureano, ask Nancy, if we believe that the product you're considering is going to be helpful for you. Next slide. So we offer a lot of different products in our office. Some are just to help plump your lips or make your under eye bags look a little bit better, but we also have things that are therapeutic. Nancy knows a whole lot about these products. Nancy?
Well, before I touch on this, I just wanted to also stress the importance of what we carry in the office as far as prescription medicine goes. A lot of times you can have the doctor's expert opinion and go home from the office with, prescription strength active ingredients that will cost far less than some of the stuff you can go to Sephora to buy that's not necessarily medical grade, such as retinols. So the doctors are really experts in determining which of those are right for you. As far as your daily regimen goes, we're expanding our line, we're revising it. We have something for everyone, and we're adding more products that we're really excited about. And we really analyze each ingredient that's going into these products and how it can benefit your skin. And we're based on what we're seeing, we could really tailor that instead of going to a store with thousands of products and having you guess and waste a lot of money on things that don't work or maybe aren't right for you. We can really kind of hone that in and kind of tailor a regimen for you. And I'm always happy to help with those questions and choosing products too.
I also want to mention that there are plenty of products that you can get in the stores that are really very, very good.
Mhm.
The point I want to make is that just do your homework, do your research, and ask us.
Yeah, and we, especially like Dr. Laureano, also we do a lot of store recommending if there's, you know, a gap that we can't fill. Dr. Laureano especially has a list of favorites, and we also have our website Regimen Pro that has doctor favorites and just products that we don't offer in the office that we really believe in are effective that we can guide you to.
Okay, thank you. Next slide, please. So just getting back to basics, lumps, bumps, and spots, we all have them. You can get them from the time you're born, and you can develop them through your adulthood. I think the most important point I really want to make is you really should have them evaluated by a board-certified dermatologist. Going to a med spa, asking anybody to just look at it and say, oh, I think that's nothing. I don't know that that's a wise idea. There are so many different types of skin lesions, and you want to be sure that what you want treated has absolutely no potential to be a problem. It's not a precancer, it's not a cancer. You want to be sure it's benign. And then what we would do here in the office is come up with a treatment plan that can help improve whatever is disturbing you. And many of these procedures don't have a lot of downtime. Some of them are much more simple than you would think. So next slide, please. There are lots of different kinds of brown spots. We can think about freckles that are really from the sun. We can think about raised up brown spots, flat brown spots that are what we call pigmented lesions. But we can laser away brown spots very easily. And in the video, you can see that I'm just taking a couple of brown spots and using an Alexandrite laser, which will destroy the brown spot. It's not a magic wand. What happens is they injure the pigment, and the pigment slowly exfoliates. They look a little bit gray-brown, and they just kind of exfoliate on their own. And there's really no downtime to that. But again, most importantly, make sure they're benign before we treat. Next slide, please. Now, not every brown spot needs a device or needs a procedure. There are some spots that we can use creams on. And this is a patient that I saw who was really troubled by a condition called melasma. And melasma happens due to hormone stimulation. It's not known why some people are more prone to it, but just using a prescription grade topical bleaching agent, after 6 weeks, you can see really a tremendous difference in the color of her skin. It may not be perfect, but it's significantly improved, and that's just by using a cream. Next slide, please. So benign keratoses, very common. They're raised up sort of scaly spots that people get on their skin. We see them thousands of times a day in the office. And if they're bothersome to you, we can treat them. Dr. Laureano, you want to talk a little bit about these lesions?
Sure, yeah, if you go to the next slide, it's actually a video of me removing one of these seborrheic keratosis from a patient. It's quite simple. You can either inject a little bit of anesthetic and or using topical anesthetic to numb up the area. And then I'm simply just using electrocautery to destroy the lesion. And then we just kind of just scrape it right off. And the post-procedure care is pretty simple. We just want to keep it hydrated with a little bit of Aquaphor or Vaseline. And within the span of like a week or so, it's gone and it's fully healed and no more seborrheic keratoses.
Next slide, please. These are before and after pictures. These are pretty extreme cases of people that have lots of spots on their face that they find bothersome and unsightly. And most importantly, we make sure they're benign first. And then with simple treatment that Dr. Laureano just discussed, we can improve them significantly. Next slide. Another example of the way we can improve brown spots on the face. Very little downtime and fairly simple to do in the office. Next slide. Dr. Laureano, would you like to talk a little bit about cherry angioma?
Sure. So cherry angiomas are very, very common. They can come at any age, and they're just like these focal collections of just a blood vessel. So they look very, very red, hence the name cherry angioma. And just like we talked about with the seborrheic keratoses, we can use either laser, we can use the electrocautery to destroy these blood vessels. And same kind of premise in terms of the wound care, very easy healing time. But yeah, these are all benign and can be removed. Yeah. Next slide. I think there's a video in this next slide of us using the electrocautery to destroy these lesions. It's very simple.
They get numbed up with a little bit of anesthesia, and you can see a couple of red dots. I apologize, we can't quite get it as clear as we'd like, but we just numb them up with a little anesthesia, and we just destroy them with a little cautery unit. And very easy, heal very quickly. There's no real treatment except a little bit of Aquaphor or healing ointment on them after. You can shower, you can bathe, and simple and done. And one point I'd like to make is many people ask me about many of these spots. Is there anything you can do to prevent them? Dr. Laureano, would you like to answer that question?
Absolutely not. You cannot do anything to prevent them, unfortunately. So they will happen, and if you don't like them, we can get rid of them, but there's no way of preventing them.
Unfortunately, this is just the way some people are genetically wired to make some of these things. So we have treatments for them, but we can't stop your body from making them. Perhaps one day we'll be able to do that, but right now we don't have that technology. Next slide. Skin tags. Everybody has them, and a lot of people don't like them. If you don't mind them, leave them alone. They're harmless. They have no ability to do anything bad. But if you don't like them, you can just have one of us clip them off with a little instrument. They occur commonly on the neck. They can occur on the underarms, many locations, but easy to remove if you just don't like them. Next slide. Next slide.
And I would be wary of trying to remove skin tags at home. There's a lot of like things that you can get over the counter on Amazon, things like that, that they promise that the tag will go away. It actually can give you a rash. They're not good. I say first see us before you decide to remove a skin tag at home.
And you also want to make sure it's a skin tag.
Yes, exactly.
So we just covered some really basic skin lesions that we can treat easily in the office. And that's what I really meant when we designed this virtual webinar, to just talk about things that are very easy to do. Neuromodulators, probably the most common cosmetic procedure done throughout the world, also known as Botox, Dysport, Xeomin. It's sort of like Coke and Pepsi. They're just different formulas, but they're basically all cola products. And they're easy to use in the right hands, but they're meant only for specific kinds of wrinkles. There are some wrinkles that are made much worse because they are underneath muscle, and when the muscle moves, it makes the wrinkle look much worse. For instance, the wrinkles on your forehead, the wrinkles on the sides of your eyes, on the nose, these are called your bunny lines in here. There are lots of areas we can use it. And the great thing is that it works within a week or two, and it really does soften and improve. The bad part is that they only last 3 to 4 months, although there's going to be a new product on the market shortly, but we're not going to talk about that till it's available. Next slide, please. Just a short slide to show you these are movable muscles. That's called your glabella, the middle part of your forehead. And you can look at how the wrinkles move upward on her forehead. And the idea here is by just putting in a neuromodulator, the muscles no longer will move the same way. And as they soften, it softens the appearance of the forehead between the brows and also on the forehead. And it's very, very easy to do. And a lot of people are frightened. They hear it's a toxin. This toxin is used every day of the year by every dermatologist all over the world. And they're in the right hands, there are really no significant side effects. Dr. Laureano, anything to add?
Like you said, very, very little side effects. Of course, you have to be in good hands, mind you. But I always tell my patients, especially people who've never tried Botox Dysport, I say, try it once. It goes away. It's not permanent. And odds are you're probably going to end up liking it. So it's one of my favorites.
Yeah. Okay, I think we can go to the next slide. So fillers. Fillers have been around for many years, and they've really gotten much better over the past 5 to 6 years. I don't like to call them fillers. I like to call them volumizers. They're great to treat wrinkles that are on the lower half of the face, what we call the perioral commissures. They're great for the lips. They can be great for the cheeks and for the jowls. And the results are fairly immediate. And fillers really work in a variety of ways. Next slide, please. But what they really don't do well is fill a crack. You can't take a crack or an etch mark in your skin and fill it in and make it look like there's nothing there. There are some fillers that are designed to do it, but they just don't do it as well as we would like them to do it. You agree, Dr. Laureano?
I agree.
And especially on the upper lip, right?
Yeah, it's an area that a lot of patients complain about where you have these etched in lines, but it's just not I don't like to use volumizers or fillers there because we can't make this line disappear. We can't erase it. So it's not my go-to.
Next slide, please. So we're just loading, sorry about that. You can treat young, we can treat middle-aged and older individuals. We have many millennials, Gen Zs wanting their lips done. And this is a generational thing. There are many people that want large, voluptuous lips, and it can be done. But there are many people that say that with age, they've lost their upper lip. And so if you've lost the volume in your upper lip, we can just accent your upper lip and just give you back just a slight modicum of fullness to make you feel as though when you put lipstick on for the women or even the men, that you just feel as though you have a healthy, younger looking lip. And Dr. Laureano, you want to tell everybody when this loads what we're doing in this slide?
Sure. So as you were watching in the video with the lip, we're simply using a syringe with a needle, right, to fill the lips. But in this video, we're actually using cannula method. And a cannula is a long, slender, blunt tube where we are basically making a port of entry into the skin to then take this slender tube and kind of feed it underneath the skin to deposit the filler or the volumizer. It's actually really safe to do. And it's something where, minimizing bruising, it is something we can use in multiple locations, and we don't have to use that syringe to make multiple points of entry. So thus minimizing bruising and much, much safer. It's one of my favorite things to use when I do filler.
Also notice it doesn't look like the patient's in much discomfort, and there's just not a lot of bleeding when you use a cannula. It's just a nice way, and it's not for every patient to use. I don't use it in the lips, some people do, but there's some areas where we're sculpting it in and we do use a needle, but there are many areas we can use a cannula to just volumize and accent. Next slide, please. So just to give you an idea before and after, obviously a Gen Zer and wanted fuller lips, and we were able to give her a fuller upper lip and a fuller bottom. Next slide, please. So just as I was saying before about filling cracks, fillers do help volumize you, and they do improve those etch marks on your skin, but as you can see, they don't really get rid of them 100%. And if these etch marks are really bothering you, there is treatment, but it's much more aggressive. And we do this in the office. There are radio frequency devices and CO2 lasers where we can actually improve the overall quality of the skin by injuring the very, very top layers and getting the collagen to rejuvenate. Next slide. Fillers can be subtle. Look at her cheeks. We're just subtly raising her cheeks. You don't need to do a lot. This beautiful woman just wanted a little accent on her upper cheeks. Next slide. Some people just want a different contour to their face, so we can put it into the jawline and into the chin to kind of give her a sharper angle along the jaw and the chin line. So it's not always about filling a hole. Next slide. Sculptra, one of my favorite volumizers to you, but it's not a hyaluronic acid like we've talked about before. Dr. Laureano, you want to discuss?
Sure. Yeah, sure. So, yeah, in regards to the hyaluronic, that's something as we inject, as you can see with that before and after of the lips, it's you kind of like see results right away. Sculptra is a little different. You're not going to see results right away. But how it works is that there's these particles and they're called poly-L-lactic acid. And we inject these particles into an area that needs a lot of volume. And it's these particles that stimulate the production of collagen, builds more collagen, more elastin, to thus help volumize over time. So with the hyaluronics, you kind of like see the improvement right away. But this with Sculptra, you have to be a little bit more patient to let those particles work and volumize the area. It's a really awesome, awesome product. It works over time. It's great.
We do a lot of Sculptra in the office, and it's something I would encourage people who have a lot of volume loss in their face to consider. We're happy to talk to you about it because we get really fantastic results. So if you're interested, certainly give us a call, but don't rule it out. A lot of people, it has some bad publicity many years ago, but we can discuss it with you and really explain the pros and the cons of Sculptra. Next slide. This is a big one. This is really the latest and the greatest in our lasers, which is skin texture and tone. We've been talking about filling. We've been talking about lumps and bumps. We've been talking about relaxing with Botox. But the surface of our skin, where we have all those etch marks, the deep etch marks, yes, they require a much more aggressive treatment. But just to get a glow and just to soften some of those etch marks, we have a variety of devices we can use. Next. Morpheus is a radio frequency device. It is not a laser. When you want to improve a problem in the skin, you can use light waves, and that's laser energy, or you can use electricity, and that's radio frequency. And what we're doing in this video is there are little fine needles going underneath the skin, and they're heating up the collagen. And when you heat up the collagen, it causes contraction and rejuvenation. And I'm showing you some of the needles here. And these needles can be applied superficially for the very surface of the skin, or more deeply to really contract the collagen. So more superficial for your overall texture and tone, and deeper for contraction and pulling and tightening. And you can see this going in, and the redness is because, excuse me, of the energy that we're putting in her face. Now, this is certainly a much more aggressive procedure, but there are some people that require it and do benefit from it, and it's something we're happy to discuss with you. Next slide, please. Just to give you some examples of what radiofrequency can do in terms of injuring the underlying collagen and tightening. Next slide, please. And helping with the fine wrinkling. Next slide, please. Necks are a big problem, and we can tighten the necks going very deeply with the radiofrequency. Next slide, please. Again, more examples. Dr. Laureano, do you have anything to add here?
No, that it's a great treatment. We do it often here in the office. It is a little bit more, we have patients come in about like 30 minutes or so before the treatment, so we can do topical numbing. It's a little on the painful side, but it's very tolerable, and the numbing helps. And also we do have nitrous oxide here at the office as well. So any of our procedures, that is an option to be used, including with the Morpheus. So I love this device for acne scars, for tightening. It's awesome. It's really good.
Next slide, please. So acne scarring is a big problem, and acne is a big problem. And there are many people that are bothered by their scarring. And by injuring the collagen more deeply, we can really cause collagen remodeling. And it really is very, very effective at helping people that have acne scarring. It will work much better with new scars. It's not going to work great with old scars, but new scars, it works great. Next slide, please. And now we have Lutronic LaseMD, and Dr. Laureano is going to talk a little bit about that. But I also want to add, let Nancy add that she does an awful lot for texture and tone too. Nancy, would you like to speak a little bit about what you do before we talk about LaseMD?
Yeah, well, what I do for texture and tone can be, a precursor to a lot of these treatments that the doctors are so skilled at handling. It can also be used to supplement some of these treatments that the doctors do. For example, if you do decide to go ahead and get some laser, we can maintain your pigment with some mild pigment adjustments and brightening with some mild peels with microdermabrasion and just a lot of like infusion of some active ingredients like tranexamic acid, niacinamide, just a lot of like high quality active ingredients to kind of keep your brightness and maintain it after or before you use one of these devices. So it's a good supplement.
Dr. Laureano?
Sure. So LaseMD Lutronic, this is one of my favorite lasers here. In comparison to Morpheus, this laser, it's a little different. It's more for facial resurfacing, helping with pigmentation, skin tone, and texture. It's not going to necessarily tighten. It's just going to help and just improve the texture of your skin. It's a non-ablative, I think it's a 1927 nanometer fractional thulium laser, and it has pretty little downtime. If you go to the next slide, I think we have a video showing the device and then also how it operates. And it feels just like a little electric shocks over the skin, and we kind of roll it over. The day that you do it, it'll be a little bit red, but it's about a week or so of downtime. After the redness subsides, you kind of have like this sandpapery, gritty feel. But it's awesome in terms of helping improve pigment resurfacing, and we love to use it. If you go to the next slide, I think you can see a live, just after the live treatment, where you can see how red a patient can be, but this only lasts for about, I would say 10 hours, right, Dr. Scherl?
And some people a little longer, but for the most part, 10 hours. But it's very, very manageable. And the roughness that you feel after is just the dead skin cells that are just going to desquamate. And what happens is when you injure those skin cells, it tells your body, it triggers your body and says, hey, make new skin cells, make new collagen. It's making it all very superficially, but that's how it works. And the most amazing thing about this laser is it's about as close to being airbrushed as you're going to be without the help of a computer or a television. I mean, the bottom line is that we can really give you a glow. And we also use it for sun damage and for brown mottled pigment on the chest, as you see in this video on the left. There are a lot of people that have just lots of browns and a lot of discoloration on the chest wall, and it's just dull. And we can run the device across the chest as well. You can run it anywhere on the body. If you don't like the way the arms are looking, if your arms are looking dull and you don't like the way your short sleeves look, you can run it up and down an arm. It's very safe, and there are just very few side effects with it. We love it, and we get great reviews from everybody that does it. Mm-hmm. Next slide, please. Nancy, take it away.
Well, the way that this laser works is it kind of goes over the skin and blasts random tiny little holes, not very deep holes, but holes nonetheless, that are part of the rejuvenation process, and that's why it's a fractionated laser. But that also gives us a awesome opportunity to, while those channels are open, infuse cosmeceutical ingredients. As you can see in this video, we're applying directly after the laser treatment a growth factor serum called ProCell. Growth factors are essential in signaling repair messengers in the skin that can kind of boost your skin's ability to heal and renew following a treatment like this, where we're, administering a controlled injury to the skin. So adding something into those channels is just giving you more enhancement and more opportunity to add more benefit to the treatment and treat specific concerns of the skin. So we have a number of topicals that we can use. Growth factors is just one of them. We've also started introducing hydroquinone to help lighten up melasma, niacinamide for pore size. We also have brightening serums that can help suppress pigmentation. So we're really making the best use of those channels that we just created with this laser by adding a topical directly after treatment.
Thanks. Great presentation. And this is really a frontier in dermatology. We'll talk about it at the very end, which is laser-assisted drug delivery. That's what this is. Next slide, please. And Dr. Laureano has become a real expert in PRP. So Dr. Laureano.
Yeah, so PRP stands for platelet-rich plasma, and I like to use it in practice for hair growth and hair regeneration. And it's a very simple process. What we do, you come into the office and we actually draw a vial of your blood. We then take this blood and put it into a centrifuge, and it spins around very, very quickly where it separates the cells from the plasma. And in this plasma are your platelets. And platelets have growth factors in them. And growth factors are awesome in helping to just regenerate hair, also cause angiogenesis, which is more blood flow to the hair follicle. And so if you go to the next slide, you can see that is a picture of the separation of the red blood cells at the bottom with what we call liquid gold, or the platelet-rich plasma on top. We then, if you play the video, take that vial and just kind of put it upside down and then pull in that platelet-rich plasma, and then I inject it directly into the scalp. And we recommend doing a series of 3 treatments spaced out about a month apart. And then we recommend one like yearly just to help maintain the hair growth. But it's a great treatment and it's a very, very effective. I also recommend doing this with other modalities as well, such as topicals, also oral medications. But it's an awesome treatment. It's great.
Okay, thank you. Next slide. Okay, the future. We spoke a little bit about laser-assisted drug delivery, and that really is going to be the future. Using lasers to create channels and then applying medication to enhance their absorption, that's really becoming very, very popular, and we're going to see improvement in that technology. There's also going to be new technology that will allow us to improve eye bags, those little fat pads that people get under your eyes, and also to give us a little bit of a lift. Oh, excuse me, my lights went out. Hold on one second, everybody. Lights are on. We're very energy conscious, so the lights go out when we're not. The radio frequency devices that we're going to be able to put under the skin with a probe that are going to work on the fibrous tissue under the skin to help pull it back. There are many people that say to us, you know, we're here because we do not want surgery. We don't want general anesthesia. And we understand that. And if you want to go for a blepharoplasty, or you do want to go for that facelift, we encourage it. If you go to somebody that suggests that you do it and you're going to get a great result, we encourage it. But there are many people that aren't interested in that. And that's where we step in and try and offer other possible interventions if you don't want more aggressive surgical interventions. Next slide, please. So we try to give you an overview of some of the things that we're doing here in the office to make you feel good, to self-care for all of our patients. Yes, of course, we're still doing lots of general medical dermatology, and we see children and adults of all ages to treat all of their skin needs. But we also are incredibly curious and want to be on the cutting edge of everything going on in the world of dermatology, and that's why we try and keep up with the latest and the greatest. And in an effort to keep up with that, we've designed this webinar to just educate all of our patients. We have Self-Care Day coming up. It's on a Saturday, a week from Saturday, where if you want to come in for a treatment, we're going to offer Lutronic, Alexandrite, all the treatments that we just spoke about. And we have some nice products to give away. And also if you come in just to make it a little bit more palatable, a 20-minute microdermabrasion, and introduce you to Nancy, who does an amazing job with her aesthetic talents. And at the very end, I think we're going to do it maybe after question and answer, just for thanking everybody that attends. Reese is going to do it, who's moderating it. Choose a lucky winner to receive either a free syringe of Botox or filler to be used in the new year. And with that, I think we're ready for questions and we'll give you some answers, we hope.
Perfect. Thank you so much. That was so much amazing information. I hope you all learned a lot and have some questions coming up for us. So here we go. I'll just, let's just stop sharing this if possible. Or here, actually, if you guys want to take a screenshot real fast, if anyone needs our phone number or website or to follow us on social media, that would be great. All right, so without further ado, if we want to close this down, let's get into the question and answers. So first up, how do these treatments you're talking about hurt?
Some do, some don't. Like I said, we offer topical anesthesia. We have injectable anesthesia. We also have nitrous oxide available here. I think maybe they might have asked that in particular about Morpheus. I mean, we have a bunch of different things that we can, offer in order to help that pain or just make things a little bit easier to tolerate. But it's really not bad.
Quick, I have something to add to that. For those that don't know, the nitrous oxide, it's otherwise known as laughing gas. It can be used on 99.9% of people. It wears off in 10 minutes. You can drive home afterwards. It just overrides the pain receptors and kind of helps with some of the like the microneedling procedures, some of the more heavy hitting treatments, but otherwise the lidocaine does a great job, and topical numbing cream as well. So we minimize it as much as possible.
So long story short, don't let any pain or hurt could stop you from coming in. It's all manageable. All right. Do you recommend preventative Botox?
So for all the Gen Zs and millennials out there, it's not that I recommend it. Our young patient population is coming in and asking us for it. I will tell you in all honesty, my own daughter asked me for it, and how can I refuse my own daughter? It's called rejuvenation for us middle-aged people, and it's called prejuvenation for the younger generation. So yes, you can do Botox on younger people to prevent the etch marks that some people get across the forehead. So it's become incredibly popular. And do I have a cutoff who I won't do it on? It's a tough question. I've had 20-year-olds come in and ask for it. And listen, I know it's going to wear off in 3 to 4 months. So, I mean, I don't feel as though I want to talk them out of it. Let them try it. They don't like it, they'll never do it again. They love it. It's up to them how often they want to come back. So I try and go over it with them and educate them before we do it.
I agree. And always easier to treat before the creases are there at rest, right?
Yep, it's true.
That's what I tried to tell myself. I started at about 21, I think. Very happy I did.
Yeah.
All right. What laser can be used to remove broken capillaries on the face?
So 2 types. We have IPL, which we did not go into on this webinar, just because we just couldn't cover everything that we do. IPL is not a true laser. It's intense pulse light. It's multiple wavelengths of light laser. So there's some people that come in with diffuse blood vessels on their face and a background of redness. We can treat them with an IPL device and get fantastic results. We can also use our YAG laser, which is specific for red spots. And we basically color the red in on the blood vessels, and we can get a very, very effective, great result.
All right. Can the platelet-rich plasma or PRP treatment be used on a male who's totally bald? Would it help grow hair back?
Well, studies have shown its efficacy, but it depends on how long the patient has had this hair loss. And I always say there's no guarantees. There's no guarantees. You know, you have, like I said, doesn't stand alone by itself to help hair grow. You have to be using some topicals, maybe even orals, and then this is an adjuvant treatment. But you know, it's something, it may help, it might not help, but if you've tried everything and you want to try something else, it's definitely worth a try. It's worth a try. The studies are there. The studies are there.
We're not going to do a procedure on you that we don't think is going to be helpful.
Yeah.
That's not who we are. If we really think something is not right for you, we're going to tell you.
Yeah.
All right. Is the removal of skin tags covered under Medicare?
Many of the removal of most benign growths, there are some exceptions, but most benign growth, including skin tags, are not covered by any insurance company, including Medicare. And I just want to point out that the way Medicare views this is it's not necessary. If it's not a cancer, if it's not life-threatening, and it's not a real quality of life issue, they won't cover it. And I can tell you that there are many things they should cover and they don't cover. And some people say, well, my skin tags really bother me. I wish I could tell you they would cover it, but you know, there is so much we do that is necessary that they just refuse to cover.
All right. If I'm interested in making my face look better, at least considering the opportunities, after coming to this webinar, what is the next step? Are we going to consider it together? Do we come talk about it? What's the next step?
Well, there's no menu. There's a different recipe for everybody. But Dr. Laureano, take it away.
Well, I think that, you know, whatever you're interested in, you should make a consultation with us so we can talk about specifics to you, right? And I always ask my patient, what bothers you? What bothers you? And then we'll address what bothers you. We'll see what options there are. We'll tell you if this is good for you, if this is not good for you. We're not going to push anything. It's what bothers you. But you have to talk to us and tell us what bothers you.
So the answer is yes. Come in and schedule a consultation as your next step, please.
Yes, exactly.
But what I like to do with everybody is I like to put a mirror right in front and say, show me, tell me, explain to me. Because it's not always obvious what I see may not be what you see. We all have our own opinions of ourselves.
Exactly.
Love that. All right. For existing patients, can we schedule a consultation for filler or neuromodulator treatment at the same time as a yearly skin check follow-up? Or can filler and Botox be added the same day as a regular skin check?
We'd like a little bit more time if you're coming in to consult for a filler. But listen, if consulting for a filler, we're going to say, yes, these are what we think would be right for you. This is the risk. This is the benefit. I'm not going to say it's a short consult, but we try and really explain it well within 10 minutes. But sometimes we have 10 minutes during a routine checkup and sometimes we don't. So it's always better to mention that you want to go over cosmetics so that we can try and put a little bit more time in the schedule.
Exactly. It's all about time. As someone who's a true perfectionist, I like to take my time, and thus I never want to rush anything. And, you know, taking time to check someone from head to toe is important. We don't want to miss anything. And then, doing a filler does take time as well. So if we have that allotted time, we can try to, carve that out. But sometimes it's just a little bit easier to kind of separate them and do them separately. But it just depends on the time.
Yeah, it's all time. And sometimes people will come in and say, do you have time to laser some brown spots? If I have the time, I'll do it. If I don't, I'll ask you to come back. But it just takes us, and not to minimize what it takes to do these things correctly. If you're coming in for Botox and you understand why you're doing it and you just have a few questions, it's a regular appointment. Putting Botox in just takes literally 5 to 8 minutes. Mm-hmm. So you don't need a lot of extra time. What really takes extra time are things like the fillers and the lasers and the radio frequency.
Mm-hmm. Okay, so if they want to piggyback it, I guess they should call the office and tell them they'd like to discuss it as well, so they can put a little bit more room in the schedule.
Right, and we try and we have some block time where we try and do more procedures.
Yeah.
And then, yes, if we're doing the procedure, if you're scheduled to do your laser and you're also due for your full skin exam, sure, you'll schedule for your laser and we'll do the full skin exam. We try and accommodate everybody as best as we can.
Great, perfect. All right. How long do you have to wait to get Botox or filler before or after RF microneedling?
So I try not to do them on the same day. And part of my reasoning is that when you're doing RF microneedling, you're heating up the skin. I don't want to heat up the skin and then put Botox in heated up skin. I don't want to put Botox in your skin and then heat it up with the radio frequency. So and then if you're having an issue, you're having pain, you're having any kind of issue, well, what caused the problem? Was it the radio frequency? Was it the Botox? We rarely see side effects from Botox, but I like to keep things simple. And what I'll tell a lot of people is, oh, I'm sorry, I can't do both, but here's what we'll do. We'll do this, we'll do your RF because that takes more time if you're scheduled for it. And we'll just fit you in to do the Botox first thing in the morning or last thing at night. We can always do Botox, especially for patients that have had it before, because we know what you need and it's just a very common and just like I said, a 5 to 8 minute procedure.
Great. All right. Here's a quick answer, hopefully. How long does Sculptra last?
Great question. It can last 2 years. And it really does last 2 years. It's a totally different product than hyaluronics. Now, some of the hyaluronics claim that they last 9 to 12 months. And I think if you put enough of the hyaluronic in, it does last longer. But no doubt Sculptra does last longer than hyaluronics. Now, I tell everybody, whether it's hyaluronic or Sculptra, you don't want to go from empty to full, empty to full. I tell people that even with a hyaluronic, as you see it starting to go away, and you can take selfies and watch yourself, but if you're not sure, come in and get it redone before it's totally gone. And I tell everybody that, and that's not to constantly bring you back. It's just so that you can keep it up. It's more about prevention, even as we're doing these products.
All right.
Dr. Laureano, anything to add there?
No, I agree. I think I always tell everyone with Botox, you can go either way. Yes, you can make it can all wear off and then you start from fresh. But if you don't like the motion and you're seeing the motion, come in for a couple units to kind of keep it going and keep that prevention going on.
Okay, here's a great question that I bet a lot of people are wondering. What does radio frequency actually do?
It's a controlled injury, as Nancy so eloquently put it before. You're injuring collagen, you're injuring fibroblasts, and when you create an injury, your body's response is to repair. That's the bottom line. So you start to repair, and it contracts and it causes tightening. But it can also injure sebaceous glands, and that's how it works on acne.
Active acne.
And it also, when it stimulates the collagen, that's how it helps scarring. So it's a controlled injury, would be the best way to put it.
Mhm.
Great. Well, here's a kind of a follow-up.
Well, that's the energy in the form of heat.
All right, well, here's a follow-up question for radio frequency. I've seen women with red peeling skin on their face and it looks pretty bad. They couldn't go to work like that, or I couldn't go to work like that. Is that what I can expect from the RF treatment?
It depends how aggressive we get. We don't have, most people say they can go to work in 2 days. It's not so much peeling with RF, it's a little swelling and crusting, less peeling. The peeling is more when you do a resurfacing procedure. Now, Lutronic is resurfacing, but it's a very, very superficial resurfacing. CO2 laser is a more aggressive resurfacing procedure, and it works great, but there's absolutely more downtime. And that's why it's become less popular, is because people don't want the downtime anymore. And we have CO2 laser in the office, it's just that people don't want it anymore. We can almost recreate CO2, almost, not quite, by doing radio frequency, but doing it very, very superficially to injure the very, very surface of the skin with the radio frequency needle. And we can take it a step further and we can do what's called a total. And a total, Dr. Laureano, you want to talk about that? Morpheus electronic?
Yeah, so a total facial, you can think of as a total rejuvenation. We first do the Morpheus or the RF microneedling, and we then follow it right after with the Lutronic. So you're
Same
getting,
visit.
yep, one visit. We do Morpheus first, so you're getting the injury with, building more collagen and elastin, that heat energy, and then we follow it with the Lutronic to do the resurfacing. So you can do both at one time. That's great.
All right. Does the Ultra work well on rosacea?
No, it does not. It does not work well on rosacea. It does not treat rosacea, unfortunately.
But we have other devices.
Yes, we have an IPL, which is great for rosacea. That is our go-to. But yeah, no, the Lutronic does not help to improve rosacea.
All right. Is collagen powder a viable option to improve skin tone and bumps?
Taking it by mouth, you're talking about it? I think a lot of people are taking collagen by mouth. We don't have enough data yet. I would tell you that I don't know enough about it to speak 100%, but I would tell everybody, I don't think there's any harm, but I don't know if there's enough data to suggest that taking collagen by mouth is going to actually have any effect on the skin. We just don't have the data yet.
Mhm.
All right, last couple questions, guys. Stay tuned, and then we're going to pick our winners, so don't leave yet. All right, do you recommend to combine doing Sculptra, Morpheus, and Lutronic? And what gap is there between all of them, and how often do I do them?
So there's not one treatment that does it all. Sculptra will volumize you. Morpheus can change your texture and tone and can tighten you. Lutronic's going to give you a glow. And the exact recipe for what's going to work best for you will depend upon the individual. But the order of things in general is to do all the devices and then Sculptra last, in general. Now, sometimes that's not the way it works out. But generally, we'll tighten and tone, and then we'll put either Sculptra or hyaluronics in.
Okay, before I get to the last few questions, we have a really nice comment here I want to read. This person said, "This was a great seminar to learn about these treatments. I've been thinking about neuromodulators and fillers for months since a friend had Botox on her forehead wrinkles. Now I understand what's involved in the process. Thank you, Dr. Scherl, Dr. Laureano, and Nancy from a longtime patient."
And we appreciate that. We really just want to give the advice, and we love what we do. We love helping our patients, and tell you the truth, it's fun finding new devices and new products to make us look better, feel better, and look great. We do love it, and that's why we do it.
Great. So amazing. Okay, well, let's get to our winner. How about that? So I used an app on my phone, so it's real. And the winner is first name only, Rosetta. So Rosetta, we will reach out to you for your complimentary treatment. And I hope you're there at home saying yay. So congratulations and thank you for tuning in. And everyone else is eligible, for our special pricing at our upcoming special day, our beauty day, laser day. And any final last words or what anyone should do to get onto the schedule for that day before we get booked up?
I would encourage everybody to call so you can get what you want if you're interested in coming in. So we're doing, I believe this Saturday is all booked up, so it will be the following Saturday. But if you call the office and speak to the reception desk, they should be able to help everybody.
Great. Well, thank you so much for everyone that tuned in. Thank you so much, Dr. Scherl, Dr. Laureano, and Nancy.
I just want to add that if everybody really did enjoy it and you want to hear more, if you just email what you're interested in hearing about, we can put another one together in a few months. So just let us know.
Absolutely. And, we really hope that this is a way for you guys to be comfortable at home, no pressure, just to come and learn about things. And then you can decide, if and when you're ready to make a consultation. Okay. There's just so many great new technologies out there. We just want to keep everyone in the loop. So, All right. Yes, December 4th is the date for someone asking again. So otherwise, I know it's evening time now for everyone that's local. So have a good rest of your evening, and please call us in the morning. And we really look forward to seeing you all soon. So thank you all so much again. Thanks,
Thank you.
doctors.
Good night, everybody, and thank you
Bye.
for joining us.